Hello, I'm Tori. I'm the Clinical Practitioner Lead for Docobo in Warwickshire North. My job is to monitor patients with COPD using the remote monitoring system. So we implemented the system to help patients with chronic long-term conditions with COPD. 6 months ago, we had 50 patients registered for COPD remote monitoring. Since then, we have now enrolled 175 patients for Docobo in a Box COPD monitoring. This has been due to evaluations from feedback from patients from GP surgeries that has shown a reduce in GP contact time, admin time and practice nurse appointments. It has also shown in the feedback that patients have had an overall positive experience from the remote monitoring. The COPD monitoring was the first pilot in Warwickshire North to highlight the benefits of the remote monitoring. We've now been able to expand this to other services, including heart failure, end of life, care homes and learning disability homes. Since the introduction of remote monitoring, I've had daily contact with patients through their remote monitoring. This has ensured that patients have had that contact time with clinicians. Even if they are not triggering that day, then they can be assured that they are still being looked after. We have been able to reduce the GP contact time, practice nurse appointment time and admin time for the GP practices. We also are able to provide education and training over the phone to patients, which has enabled patients to stay at home without having to ring the GP practices or contact 111 or 999 out of our services. So from working with Tom during his journey on the remote monitoring system, when he was inputting his observations on the system, we were able to identify that he was more breathless than usual. So when the ICC clinicians called him, they were able to triage the call and show that he didn't need a same-day urgent response visit, but he could do with a routine review from a clinical practitioner.
Especially since the COVID, it's been very difficult to get to and from the doctors. Like you can have a very long wait, but with the Docobo system, we get through, and if there is anything wrong with my stats, they get back to me immediately. They either come out to see me or they will correct things on the telephone, which is lovely for me.
So when talking to Tom's daughter, she spoke to me and said that it's been a weight off her shoulders. It has gave them some reassurance that Tom's okay, whereas sometimes his condition would highlight more breathless, and when they would call out of hours, then they would automatically trigger a 999 response due to their clinical pathway. But from the remote monitoring, we've been able to stop that escalation to hospital. The hospital being able to refer directly to me will help ensure patients have that extra support when being discharged home. There is a step down of remote monitoring, so they can show that they've still got that secure environment of someone closely monitoring their observations. So the impact of going back into hospital is hopefully reduced.
Since I've been monitored, there haven't been any need for me to go to the hospital. You know, it's all been sort of sorted out before it comes to that. On 2 occasions where the equipment has gone wrong, I just rang the Docobo number and she sorts it out there and then for me. One time my machine had just gone to sleep and she took me through it and made it work, so that's brilliant.
So with all devices we are bound to run into technical difficulties, and when this does happen, I've been able to refer them to the Docobo Technical Support Service, where if they've been able to contact the patient very quickly and able to either sort the device out over the phone or they've been able to send out a new device to the patients. If it's not the device problems and they need some extra training on how to use the equipment, they've been able to send out a technician to help the patients with further training to use the equipment. My advice for clinicians looking at remote monitoring is look at your cohort and identify which patients are suitable for remote monitoring. Look at a management plan for these patients, look at how they are going to be referred to the service or who's going to respond to the service and how we can monitor those patients effectively.
I like the Docobo system because it tends to cut out a lot of the to and fro to the doctor, and it's easy for me to get hold of.